Hi, everyone, and welcome to Orchard Village's annual Health and Safety Policy and Procedure Review that is required each year. After this training, you will need to complete a quiz to satisfy this training requirement. Before we get started, here are the 3 objectives for this presentation. First, we will learn to identify, prevent, and/or minimize risk for staff and clients. Next, we will learn how to respond in emergency situations. And lastly, we will learn how to appropriately report emergency and critical incidents. Orchard Village values the health and safety of all of our clients, staff, and other stakeholders. We strive to keep everyone safe and healthy. Maintenance regularly monitors and maintains the safety of our 19 buildings by keeping the homes and vehicles up to date with regular checks. However, Orchard Village relies on staff to report any safety issues, items that may need repair, issues that appear unsafe, and so on. Even a light bulb that is burned out is an important issue to be reported. So let your supervisor know of any problems in your work area. Always pay attention to your surroundings because we want to keep a high standard of safety. These are the emergency procedures that we will be reviewing during this training session: fires, natural disasters, medical emergencies, utility failures, violent or threatening situations, and bomb threats. The first topic is fire safety, which is something to take seriously in order to keep everybody safe. So we will now go through the correct fire safety procedures. It is important to know where the fire alarms are in your building. Do you know where yours are located? They are typically near doors so that you can pull the alarm as you are exiting. In the main office building, there are 4 fire alarms, one in the vestibule entrance area, one on the program side on the back wall, one in the kitchen, and one in the large conference room. After pulling the fire alarm, the fire department is directly notified because our fire alarms are connected to their emergency system. After pulling the alarm, it is important for all staff, clients, and visitors to leave the building through the closest exit, which are located next to the fire alarm, and to close doors behind you to prevent the fire from spreading. It is important for everyone to stay calm and follow these procedures. So, once you leave the building, where exactly should you go? If you are on campus, you should go to the grass area between Innovations and Orchard Academy. And if you are at one of the Scillas, you should go to the designated area on the evacuation route. The evacuation route is posted at each of the homes, so please make sure you know where those are, and if you are unsure, ask your supervisor. So how long should you wait at these designated areas? You should wait until the fire department tells you that it's safe and all clear. After meeting in the designated area, make sure that all of the people that you are responsible for are present. Staff are responsible for the clients in their care at that time. If you work in a Scilla, you should make sure that all of the clients are in the designated area. If you work in the school or Innovations, you need to make sure all of the students and attendees are congregating in the correct area. So when you evacuate, make sure that they are all present, safe, and accounted for. Supervisors are responsible for making sure their staff are safe. If anyone is unaccounted for at the office, tell Marlene or another senior staff. And if anyone is unaccounted for at the Scilla, tell the lead firefighter at the scene. Always make sure someone is looking after your clients if you are not there or not able to stay with your clients at that time. Fire alarms and drills can be scary for some of our clients, so stay calm and follow procedures to maintain safety and decrease any anxiety. All of the Orchard Village buildings have fire extinguishers. In the homes, they are located near the kitchen. In the main building, there is also one in the kitchen, as well as near the large conference room and on the program side of the building. They are purposely spread out so that they are easily accessible. Every staff should be aware of where the fire extinguishers are at their work site. Everyone should also know how to use the fire extinguisher. There is an acronym to remember: PASS, PASS, and each letter stands for how you should use the fire extinguisher. First, the P is for pull, and it means to pull the pin. A is for aim, which means to aim at the base of the fire about 6 feet away. The S is for squeeze, which means to squeeze the handle. And the last S is for sweep, which means to aim at the fire extinguisher and sweep from side to side of the fire. Now that we reviewed fire safety procedures, we will move on to natural disasters. In the Chicago area, there are many weather-related situations that we need to be aware of and know what to do in those circumstances. Snowstorms, floods, extreme temperatures are three situations where procedures may need to be followed. The president and CEO may direct the office staff to stay home, or staff will be sent home. Staff may be advised to keep clients home, and day programs may be closed. Make sure your work area has a working flashlight and batteries. If you need this, please let your manager know prior to needing it. There may be times when you may be instructed to evacuate the home or work area. At Orchard Village, we use the activity center on campus as a temporary shelter. A tornado can be very frightening. Knowing what to do can give you the confidence to handle the situation in a safe and appropriate manner. If you are in the office building during a tornado, staff can stay safe by congregating in the hallways near the bathrooms. If you are in a CILA, staff should gather the clients and move them to an area in the home away from windows. If the home has a basement, this is the best place to be. Find the area in your workplace to stay in case of a tornado, and don't forget to bring the flashlights just in case of a power outage. At Orchard Village, everyone is certified in CPR, AED, and first aid. Staff must be recertified every 2 years. The protocols that you learn in the CPR and first aid trainings are invaluable if you find yourself in a situation where these skills are needed. Each home in Orchard Village building has a first aid kit. Staff should check the first aid kit regularly to make sure everything you need is in the kit. If you are missing items, please let your manager or coordinator know. There are AEDs in the 4 buildings on campus: the office, Orchard Academy, Innovations, and the Activity Center. Take time to know where the first aid kits and the AEDs are located. Yes, we are first responders. We are the ones who are there when the emergency or incident occurs. If there is a minor injury, such as a small cut, staff can administer first aid. In the event of a more serious injury or illness, call 911. The CILAs are now equipped with Station MD. Staff can call the phone number located on the Station MD apparatus, and a navigator will assist the staff in getting set up for the doctor visit. The doctors on Station MD are emergency doctors with vast experience working with people with disabilities. This is a new and wonderful system that will assist staff with many health issues. We will now move on to the universal precautions. This is the protocol to protect ourselves from bloodborne pathogens. We have become more aware of this due to the COVID pandemic and have been practicing protecting ourselves more than before. Universal precautions are a standard set of guidelines to prevent the transmission of bloodborne pathogens from exposure to blood and other potentially infectious materials. Some things that we can do are wash our hands for 20 seconds, wear gloves and take our gloves off properly, as we've learned in our first aid training, wear protective clothing when needed, wear our eye and mask protection when needed, as we've all become experts in due to COVID, dispose of waste in properly marked containers, clean up spills and messes using the designated procedures as soon as possible, use required daily housekeeping procedures, use precautions when handling contaminated or soiled linens, and placing intact needles or syringe units and sharps in designated disposal containers. And as always, do not break or bend needles. Another area of safety concern is if there is an incident of a utility failure. This could be an electrical outage, a gas leak, water, or flooding issues. In the event of a utility failure, contact your supervisor and maintenance manager for further instruction. Sometimes we don't know if there's going to be an outage, such as during a storm or extreme weather, but occasionally we will know if there is going to be an outage due to maintenance work being done at our facilities. In that case, we will instruct staff what to do during those time periods. If the failure is expected to last a long time, non-essential staff may be asked to go home, while staff who are with clients will be directed to a temporary shelter, such as the activity center. If the activity center is also experiencing a utility failure, a backup shelter will be determined for residential clients. Unfortunately, in this day and age, violent or threatening situations are occurring more often than previously and are a real concern, so we need to be prepared and know what to do if we find ourselves in one of those situations. If you find yourself in a dangerous or violent situation, call 911. We want to emphasize that the safety of you and the clients is our top priority. One of the most common violent or threatening situations is an active shooter. In any dangerous scenario, you should run and escape if possible. If you cannot evacuate the building, then you should hide under a desk, behind furniture or a door, or anywhere to not find yourself out in the open and vulnerable. If neither evacuating or hiding is possible, fighting is a last resort, only if you feel comfortable doing so. That would be your own personal decision. A lot of people have been hurt or killed trying to de-escalate a violent situation. So again, do so only as a last resort and only if you feel confident and comfortable doing so. If you find yourself in a situation where someone is threatening to do something in the future, inform an administrator or supervisor. Again, always call 911 if you or the clients feel unsafe or threatened, and if you are unsure when this event would take place. If you receive a bomb threat call, remain calm, listen politely, and do not hang up the phone. If possible, notify someone via text, email, from another phone, etc. If you receive a suspicious package, which may mean that it has no return address, has excessive postage, has a weird smell, is making sounds, do not touch it or move the package. Instead, notify your supervisor and call 911. We will now move on to agency vehicle safety. We often find ourselves driving our own vehicles and agency vehicles with or without clients. We always want everyone to follow the Illinois state laws and to follow the rules of the road that we learn. Very importantly, do not text or talk on the phone while driving. This is very important because many accidents occur due to people being distracted and on their phone while behind the wheel. Always remember to wear your seatbelt. Further, all passengers in the vehicle must also have a working seatbelt. In addition, in agency vehicles, before taking off, make sure to fill out the vehicle log, which is kept in each van and includes a destination, who is driving, odometer readings, among other things. Also, always perform a safety check on the vehicle before taking off. And if there are any concerns regarding the vehicle, call your supervisor. Another distraction for drivers is eating and drinking while on the road. There should be no eating or drinking while driving, and no eating or drinking in agency vehicles so that we can keep them clean. If for some reason you find yourself driving one of the agency vans and the passengers are loud and noisy, pull over. That's it. Just pull over because this is a big distraction and you may need to intervene with the passengers. Also, Orchard Village does not allow smoking in agency vehicles. Always make sure the gas tank is at least a quarter filled. You can get a gas card at the office and fill the agency vehicle with gas, but please do not add any other fluids. So, what happens if you find yourself in an accident? Call 911, even if it's a minor accident, so that it is properly documented, and exchange insurance information with the other driver involved. You always want to follow all instructions from the 911 dispatcher. After taking care of legal matters, contact your supervisor and wait for further instruction. Take as many photos as possible to document a complete record of the accident, such as the other person's driver's license and insurance card, pictures from different angles of both vehicles and their damage, and any clients, staff, and others that were involved for a record of injuries. Lastly, never admit fault. In other words, do not say that you are responsible for the mishap. Workplace violence is also something we need to address because it does happen. So, what constitutes workplace violence? Bullying, intimidation, sexual harassment, disruptive behavior, assaultive behavior, and possession and use of a weapon. We have all taken and are required to take the State of Illinois anti-harassment training to show us how to handle these situations. If you experience, witness, or suspect workplace violence, threatening behaviors, or any form of harassment, notify your supervisor and human resources. Please know that your confidentiality will be respected. If you feel threatened and you also feel comfortable communicating with the other person, feel free to do so. For less serious threats, notify your supervisor and/or human resources so that they can help mediate the situation. If the threat is serious or you feel that you are in immediate danger, evacuate the area and call 911 and then notify your supervisor. Now moving on to abuse, neglect, and exploitation reporting for the people we serve. This is a very important area to address. Everyone has taken OIG Rule 50 training, which talks about how to identify abuse, neglect, and exploitation. This presentation talks specifically about the procedures Orchard Village has in place for reporting abuse and neglect. So, if we witness or suspect abuse, neglect, or exploitation, we must immediately report it within 3 hours from discovery, because the state of Illinois requires us to report any suspicion of abuse or neglect within 4 hours. This allows your supervisor and Lindsay time to gather more information on the allegation to better be able to report it to the state of Illinois. So, in this situation, please report it directly to your supervisor and/or report to the Orchard Village Abuse and Neglect cell phone. This number is on the phone list and should be saved in everyone's phone in case of an emergency. This number is a direct number to Lindsay, who is Orchard Village's designated reporter, and this number is reachable 24 hours a day. So, even if confronted with any suspicion of abuse and neglect in the middle of the night, please call. These are our abuse, neglect, and exploitation signs that we have all around our agency buildings. On the left side of the slide, you will see that if the perpetrator is employed by Orchard Village or another agency, it gets reported directly to the Office of Inspector General. So you would notify Lindsay, and she would then report it to the Inspector General. But anyone can directly call this office if they feel more comfortable doing so. As you can see on the right side of the slide, the Adult Protective Services is who we will call if the abuse, neglect, or exploitation is done by a family member or a friend, which may be seen in home-based services or innovations. In any of the above situations, you can directly call the Office of Inspector General and Adult Protective Services, but we strongly encourage you to notify the Orchard Village Abuse and Neglect phone line first, because then we can take immediate action to protect our clients, whereas action may be delayed if only those other agencies are contacted, and meanwhile, clients may be experiencing continued abuse and neglect. When making a report, you need to speak to a live person rather than leaving a message. If unable to reach someone through the abuse and neglect phone number, contact your supervisor or an Orchard Village director and continue calling until you speak with someone live. So, everything we've talked about today falls under the critical incident category. We have gone over several of these, and some additional ones include illness, elopement, and missing individuals. All of them are critical incidents and need to be reported to your supervisors. Any client incident, whether critical or non-critical, should be reported to your supervisor because it may indicate that something else is going on. Staff-related incidents, such as a car accident or getting injured at work, requires that staff fill out a paper incident report form and turn it into their supervisor. They are available in all Orchard Village buildings. If you need one, ask your supervisor and they will print one for you. If there is a client-related incident, they are recorded in THERA as a General Event Report, GER. If you have any questions about any of the topics that we covered today, please contact your supervisor. Thank you all for your attention and contributing to the health and safety of the clients and staff at Orchard Village.